In this video, we're going to debunk the 5 most common shoulder pain myths. Hi, my name is Stuart, and today we're going to talk about shoulder pain. A lot of people think they know what's causing their shoulder pain, but a lot of the time they can be wrong. We're going to dispel some of the most common myths about shoulder pain and show you how you can fix it for good, so stay tuned. It's easy to see why some people might be persuaded by outdated shoulder beliefs, which may have become established before understanding of the problem evolved. Many of these myths make you feel like someone needs to fix the problem, but in many cases, with a better understanding, you can actually fix it yourself and save time and money. Myth number 1 is that your shoulder hurts because you have poor posture. It's common to think that your shoulder pain is caused by bad posture, but that's not true. It's worrying how many professionals continue to repeat this myth. But research has shown time and time again that posture, or any posture, is not associated with pain. People with terrible posture most often have no pain, whereas people with good posture can experience chronic pain. To help illustrate our point, here is one of our stroke survivors, Robert, practicing his walking with a rounded upper back. This posture is known as a kyphotic posture that many would say was not optimal. However, Robert is pain-free and able to perform everyday tasks within the limitations of his stroke. Now imagine you're asked to stand to attention like a soldier with perfect posture. For hours on end, you'd feel just as uncomfortable, if not more uncomfortable, than if you sat at your desk for hours on end. Now imagine performing all of your daily tasks with perfect posture that many old school therapists would prescribe. The worst posture is the one you spend a lot of time in. So instead of worrying about your posture, you're far better off focusing on how much you're walking each day and taking breaks from your desk at least every 90 minutes to get yourself a drink and keep your muscles moving. The easiest way to track your daily physical activity is to track your steps using your phone or one of the many devices out there such as a Fitbit, and aim for at least 7,500 steps a day. Myth 2 is that you should protect the shoulder until it stops hurting to prevent making it worse. Many people with shoulder problems believe they need to rest their injured shoulder so that it has time to heal itself, but the exact opposite is actually true. During the first 3 days since the onset of your pain, you may want to take it easy in case there is some soft tissue inflammation. Beyond this, however, it's really important that you gradually expose your shoulder to more stress so that you can help improve your movement and with it, improve your painful symptoms. We'll go into this in much more detail later on, but in summary, you need to keep your shoulder moving to keep it improving. Myth 3 is that your shoulder hurts because it's out of alignment and needs manipulating or mobilizing to put it back. Some people like to make their joints crack because it can feel satisfying and provide temporary short-term relief. But these changes are usually temporary and don't help the pain long-term. Although it might seem like our shoulder needs to be put back in or take a good crack, shoulder posture and alignment are not strongly linked with shoulder pain. The highest quality evidence shows that manipulation does not work for helping with long-term pain or function for the vast majority of people, and is no better than placebo. In some unfortunate cases, having these short-term treatments also creates a dependency to spend lots of money on a short-term treatment for a condition that is often completely treatable. Myth 4 is that your shoulder hurts because you're getting old and it's a sign of arthritis from wear and tear. Some people think that pain is a result of getting old, but that's not true. Shoulder pain happens to lots of people, no matter what age they are. So the idea that this type of pain is caused by your age just isn't very helpful. In fact, even those unfortunate to have severe degenerative changes in their shoulder joint can have very little pain, despite having degenerative changes in their actual shoulder joint. In one study, researchers studied a population of elderly people, and they found that 57% of elderly patients had X-ray evidence of degenerative changes of the shoulder joint with no painful symptoms. So most old people have degenerative changes in and around the shoulder joint. They're not sick, but their joints have degenerated. We can think of these as wrinkles on the inside. This is a natural process and it does not hurt the person's body to have degenerative changes and is not a predictor of shoulder pain. This is why getting a scan of your shoulder won't be very beneficial for most people with shoulder pain. Unless you have one of the red flags mentioned at the start, the scan will not inform you of why your shoulder hurts or anything else we don't already know. Myth 5 is that you shouldn't take pain medication because it will mask the pain. Some people may be hesitant to take painkillers because they believe that by doing so, they'll mask the pain and end up causing more harm. Or you could feel compelled to avoid taking medication for personal reasons. It's easy to see why you might think this, but short-term pain relief medications can help you get back to activity and recover faster if you take them according to your doctor's or pharmacist's instructions. This is because acute shoulder discomfort is typically the result of increased sensitivity in the shoulder rather than any damage. It's vital to keep in mind that pain isn't always related to harm. Gradually increasing your shoulder movement through discomfort with the assistance of anti-inflammatories after the first 3 days can help break the vicious cycle of pain, decrease movement, tightness, and sensitivity.